recording to record the session. Okay, so we will continue our class with occupational health, okay, which is this related to the environmental health. Okay, so learning outcome for this session. So you should be able to define occupational health, discuss the objective of occupational health, explain the common type of occupational hazard, and discuss function of occupational healthness, and also to discuss a component of occupational health services in Malaysia. Okay, so occupational health deal with all aspects of health and safety in workplace and has a strong focus on primary prevention of hazard. Okay, so the function of occupational health as a prevention unit, okay, that related to hazard or occupational health issues. So they will uh, prevention for employer, as a employer responsibility. So that related to health safety, that also benefit to the employee. Okay, so because occupational health is important for each company or organization that employer, majikan has uh, play the responsible. Okay, and then also as a risk factor determinant related to organization or the company. Okay, definition of occupational health. Okay, the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupation. So these three component, physical, mental, and social. So the employer should give attention to this factor to all workers from their company or their organization. Okay, and the prevention among workers of departure from health caused by their working condition, the protection of worker in their employment from risks resulting from factors adverse to health, in the placing and maintenance of the workers in an occupational environment adapted to his uh, physiological, psychological equipment. Okay, and also to if we summarize, occupational health can define as the adaptation of work to man and each man to his job. So how actually we adapt with the occupational environment that we work in order to prevent any health related to the occupational hazard. Okay. Okay. Also, the occupational health that actually branch of medicine which deal with the relationship of man and his occupation and the purpose of prevention of disease and injury, and also promotion of optimal health, productivity, and also social adjustment. Okay. Objective to maintain and promote the physical, mental, and social well-being of the workers, to prevent occupational disease and injuries, to adjust to work environment to the needs of workers. Okay, for example, as a nurse, we apply ergonomic principle while doing bed making, while transferring patient from bed to chair, or chair to bed, or from bed to stretcher. So let's say that we are going to send our patient to OT. So we have to transfer patient from bed to a stretcher. So we have to apply body mechanic. So how actually we adapt with our occupational or we adapt with our job, okay, our work environment. So and then it should be preventive rather than curative. So meaning that we have to prevent, we have to prevent any injury or any disease related to occupational, our occupation, rather than cure. So meaning that we have to prevent, so to to reduce the risk. Okay. Okay, for type of occupational hazard, okay, physical hazard. So, for example, extreme temperature, noise, electrical or mechanical. So, for example, that occupation related to, uh, for example, in factory, so the factory that produce noise. So it can cause occupational hazard to the workers that can cause hearing problems. Okay, so example. So clinical hazard. So meaning maybe for the company or organization that deal with mechanical that deal with chemical. So for example, here in Kuantan, we have a lot of company or factory that produce chemical in Gebeng, for example. So they have to do every 6 months, they have to go through the checkup, medical checkup every 6 months to ensure that they are fit, they are healthy, and there is no um, risk or diseases related to their occupation. Okay, so biological hazard. Okay, for example, virus, bacteria, fungus. So this one maybe we can say that. The lab, lab people. So they are working in lab, they are working apa tu? They are working with all the viruses, bacteria. They are doing the lab investigation. So they have risk to expose to diseases related their occupation. Okay, for example, that people are working in lab that deal to do investigation, to do swab test for COVID-19. For example, they might have risk, if they are not proper, they are not follow the proper SOP in doing their job. Okay. So, and another type, ergonomic hazard. Okay, repetitive motion, static motion, lifting weight. Ergonomic hazard, it can expose for nurses, for nurses or for factory that workers that stand to produce their product for 7 hours or 8 hours per shift. Okay, and then psychosocial hazard, so occupational stress, depression, anxiety. These are the type of occupational hazard. Okay, and also the sexual harassment maybe. Okay. Okay, this is an example. The statistic in 2017, we can see that occupational noise related hearing disorder is the highest cases. So that's why people working in factory or any organization that can expose to noise hazard, every 6 months they have to check for audiometry, for medical checkup, so to ensure that they will not get affected from their occupation. Okay, occupational health team. Occupational health specialists are ideally and uniquely placed to support and help people stay in work and live full and healthy life. Okay, they play a key role in ensuring the health and well-being of working population by preventing work-related health and providing specialist rehabilitation advice. Okay, so occupational team actually they are responsible to prevent But when it happen, okay, the workers get infected or affected from the job, so the team also play important roles for rehabilitation. Okay, so they provide independent, impartial advice to employers and employees on the effect of work on health and the effect of health on work. Okay, vice versa. Okay. Okay, the five major roles of the occupational health nurse, as a clinicians, practitioner, administrator, educator, researchers, and consultant. So, but usually for occupational health nurse, also they call uh, industry nurse. Okay, industry nurse. Okay, but in hospital we have infection control unit, which they play the important. They are not called as occupational health nurse. Okay, the in hospital is quite different. But for community setting, for occupational health nurse, usually we call industry nurse. So where they will have one or two nurses at the organization or factory, they will do all these roles. Okay, as a clinician, administrator, educator, researcher, and also consultant. Okay, occupational health team. Um, okay, as a practitioner, so they have to assess work environment. Okay, assess workers' health status, perform health surveillance. Okay, provide direct nursing care, conduct health education. Okay, since they are responsible to prevent, okay, prevent, so they have to provide awareness, they provide the health education, counseling, and collaborate, communicate, and also consult with occupational safety and help the team. To maintain the accurate, concise, and complete record, develop and implement programs, okay, to correct health and safety hazard, institute personal protective program, conduct health screening. Okay, that's why every 6 months usually they will have a medical checkup to see, to identify the health status. Is there any uh, health related issues to with the occupation. Okay, maintain awareness, coordinate and professional growth and education opportunity for staff, formulate a policy. So they will work together with occupational health and safety officer. Okay, they will not work alone. Okay, educator provide education program, utilize expert in occupational health safety planning, coordinating. For example, in our kuliah, okay, in our kuliah we have a safety officer. Safety officer, we have sign officer that they actually play a role as a safety officer to ensure that you are in the safety environment for teaching and learning. So that's why we put all the signage that don't land on the glass, right, a corridor. So this actually how the occupational health and safety officer play the roles. Okay, for our kuliah lah, for example. Okay, researcher participate in the development and implementation of research. Okay, for example, nowadays we can say that many research they are conducting related to uh, depression or stress among nurses, among healthcare provider in response to COVID-19, for example. So this is how actually we can see how the occupation can affect their health. Yeah. So for example, they have to work double shift, triple shift, more than 16 hours in response or in assessing their team. okay, related to COVID-19, for example. So that's why, so we can see how the occupation will um, affect to our health. Okay, consultant advise management regarding the health of the workers. So that's why, for example, the occupational health nurses, they give consultation or they advise to the employer. So for example, we have to do a health screening every 6 months. So and then we have to provide the education, we have to provide the um, program, for example, to increase the awareness, then the keep on do assessment, for example. Okay. Function of occupational health service, okay, pre-employment medical examination, first aid and emergency service, and supervision of the work environment, special periodic medical examination, particularly for the workers in dangerous operations. So, for example, Linas, eh? In Kuantan, we have Linas factory. So the factory that produce chemical, the radiation, so they should follow the SOP strictly, because if not, then they will cause harm to their workers. Okay, because previous, I think last 2 3 years, there is cases. I mean, apa, the discussion between government and the community around that area, because there are objection to allow Linas uh, to be operated in Kuantan, because they worried it will affect to the community health, will affect health of the community around the area. Okay, also maintenance of medical records, carry out other parallel activity, nutrition program concerning the health and welfare of the workers lah. All related to workers, they have to prevent and to ensure that the workers will be protected. Okay, components of occupational health services, they have they will have health counseling, stress management, mental health and physical health, rehab program, medical, social, education, and vocational. Okay, components of occupational health services, assessment of dust pollution, noise, vibration, heat radiation, and also the radiation. Okay, so the occupational health services, they are responsible to supervise the working environment, hazard identification, monitoring, evaluation, engineering project review, control measure, and development of personal protective devices. For example, um, people working in airport, example, so they have to wear the the what they call, they have to wear hearing protection, so because of noise, and also family welfare program to take care of the employee and dependents, okay, disaster management, and also health record maintenance. For example, so for family welfare program, so for example, the workers are being affected from their occupation. So for example, suddenly they turn to they have hearing problems. So the family should be uh, should get the apa, pampasan from that. So they cause permanently disability. So the occupational health services also concerned about the family welfare. Okay. Okay, for occupational psychological unit, so they are concerned about the stress management. They are managed for the stress among employee, job arrangement, skill development, organization development, safety awareness, absenteeism control, job satisfaction, mental health survey, and also human relation. Yeah? Okay. Occupational Safety and Health Act stand for Occupational Safety and Health, established in 1917 in America. OSHA is an agency which has oversight for workers' safety and health. Okay, so in Malaysia, uh, founded in 1993, OSHA provide a legislative framework to stimulate and encourage high strength standard of safety and health at work, and promote safety and health awareness, and establish effective safety organization through self-regulation. Okay, the objective of OSHA to establish training program to increase the number and competence of occupational safety and health personnel, to develop mandatory job safety and health. So even in kuliah of nursing also we have to follow the OSHA guideline. Yeah. For example, how we have to follow the guideline how we conduct CAC. For example, how we conduct the lab. Okay, so when you do your lab work, so how we act to ensure that you are safety. Okay. Okay, for National Institute Occupational Safety Health, NIOSH, okay, founded in December 1st, 1992, as a company limited by guarantee under the Malaysian Company Act 1965 to spearhead the safety and health culture at the workplace in Malaysia. Okay, so you have to know the OSHA, NIOSH, okay, these are the agency related to occupational health and safety. Okay, this one you can go through. The NIOSH was set up on a launching grant from the government and social security organization, or SOCSO. Okay, so for example, we have to we have to contribute some amount in the SOCSO. So when the employee get mm, get affected from their work, so they can claim, eh, can claim uh, from the hazard happen from their job. Okay, function of NIOSH for teaching, research, and consultancy. Okay, so Social Security Organization, also set up in 1971 to implement, administer, and enforce the Employee Social Security Act and Employee Social Security. So just like I mentioned, it's like insurance scheme. It's like insurance scheme. So the workers has to contribute some amount, then they can claim when the hazard happen related to their occupation. So even for example, the workers are still in the for example, nurses, nurses, they from house to go to the hospital for PM shift, for example, and then during travel she had an accident, for example, so they can claim for they can claim for because they are now going to work, during that time they are going to work, so it's considered official duty, during official duty period, so she can claim. So to claim, they have to have medical report, they have a police report, all the required document for her to claim. They are eligible to claim. And actually contribution from employee and also from employer. So for employee we pay 11%, and from employer they pay 15%. So that if anything happen during our job time, our job period, so we can claim. We can claim for the uh, apa ni lah, is like insurance scheme lah. Okay, the employment injury insurance scheme. Okay, the scheme provide workers with protection for accidents that occur while traveling, occupational disease. Okay, during job period. Okay, thank you. Okay, this very short. I mean, is apa? Ni lah, very direct. Okay, any question?
No.
I'm not sure. No, you understand or those are not open the video. The video. Are you in my class or?
In your class. Yes,
Okay
doctor.
lah.
Can you open the video for a while so that I can see your face?
No camera.
Okay, doctor.
Uh, okay. So you, it's okay because you are in Mahala, right?
Yes.
So is it any one of you at home? All in campus, on campus, right?
Yes, doctor.
Okay. So let me check for the. Okay. So no question, eh? All understand or don't understand?
Not yet, doctor.
Okay, not yet. Okay. So you can always text me or email me if you have any questions. Okay. I already uploaded the slide in iTalim, so you can have a look and read through back. And if you have any questions, so just inform me. So we will, because we will have a